This is the Man Up Podcast, the doctor's guide to men's health. Each week on our podcast, we interview the top specialists of the field on various topics in men's health. You have questions that you are too afraid to ask? We have the answers. This week, our episode is titled, Putting Some Skin in the Game, Common Dermatology Concerns for Men. I'm Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. What's up, Justin?
Hey Kevin, how are you doing? Good week here. It's still cold, but
Still warm here in Miami, so.
yeah. Well, I can't help that, so that's fine. But yeah, I'm I'm really excited for today's talk because I think one thing that a lot of guys, being dudes, neglect is their skin issues. Right? There's a lot of skin issues that guys deal with that are very specific to male needs, and I don't think we're talking enough about it. So I'm really excited that we're bringing on Dr. Timothy Wu. He's a practicing dermatologist out in Miami, and he's a really great resource for a lot of the things that we need to learn how to be doing better, because I guarantee you I could do a lot of things better for my skin and for my wellness, and I'm sure you can too.
I completely agree, Justin. I think a lot of guys, inside they care about their skin, they think about it, but don't really go and take care of it or know what to do. So I think Dr. Wu here is going to be able to provide some great insight.
Yeah. So thanks, Dr. Wu. Thanks for coming in.
For having me. Excited to be here.
All right. So why don't we just jump right in? All right. So let's just start with some of the basics. What do you think is the worst thing most guys are unknowingly doing to their skin?
Well, Justin, I think you brought up an important part. In fact, that I think a lot of men neglect their skin, and I think that they don't realize that they're potentially causing a lot of skin issues with this neglect. So, I mean, basic things like having a simple routine, washing your face before you're going to bed, using a moisturizer, can be, very important. Men may also not realize that using bar soap or liquid soap on their face may actually cause them more harm than good, for instance.
Hold on, I did not know that. Wait, so that is like brand new to me. So what kind of soap are we putting on? Do we need to be putting on our face? Because I'm using, the Dove.
I don't think I've ever used.
Skin.
I've never used bar soap on my face.
It says sensitive skin on the soap. Why can't I use it on my face? What am I supposed to use on my face?
Yeah, so I mean, bar soap is great. Does a great job for removing dirt and oil. But for the face, it actually does its job too well, in the fact that you will strip all your natural oils and essentially leave the face very dry and tight, and potentially, cause flares of eczema or skin irritation, dry skin, things like that.
So we should go with when we're washing our face, specialized soap made for the face. Then, correct?
Right. So there are a lot of synthetic facial cleansers out there that will still clean dirt and oil, but kind of leave on the natural oils that you have on your face.
Like what? So when I'm going to the store, I'm going to a CVS or a Walgreens. Like, what's the key word here that I'm going to buy? Because I'm literally
facial wash.
Yeah, it doesn't say facial.
So yeah, look for things like gentle facial cleanser. Usually I recommend fragrance free to reduce irritation.
Okay.
But yeah, essentially just a facial cleanser.
And we should be doing that every night, right? Before we go to bed.
Yeah, every night. And then a moisturizer. So moisturizer is also very important because you want to, repair the skin barrier, protect the skin, keep it hydrated.
So
awesome.
Yeah. So one thing, there's a lot of products that market having retinol in them for nighttime cream moisturizers. Is that something that's important or no? Or is that like some sort of advertising scam?
No, retinol is very important. So I recommend it to a lot of my patients. The retinols help. They can increase collagen, improve fine lines, wrinkles. Basically, it's kind of a very important in any anti-aging, anti-wrinkle regimen.
Okay, so here's another question. Am I hair shampoo? Do I shampoo every day or do I shampoo every other day? When do I conditioner? Is there like a
That's a great question.
routine there? Like I always like, I used to shampoo every day. Then someone said it dries out your hair. Now I shampoo like every other day. What's the situation?
I mean, me personally, I think it's fine to shampoo your hair every day. We actually recommend that for, certain conditions such as seborrheic dermatitis, which, causes dandruff. So even, not even using medicated shampoos, just shampooing more frequently can often help in that condition.
All right. So let's get back to the skin. Sunscreen. Us being down here in Miami, Justin will be soon again. When are we supposed to wear sunscreen, and what SPFs should we be using if we're supposed to wear sunscreen?
Right. So, I mean, if you ask me, you should wear sunscreen every day. Particularly, if you'll be out in the sun for, a few hours or, within the periods of 10 a.m. to 4 p.m. When the sun is the strongest.
So like you're saying, even in Chicago right now, it's winter. I should be wearing sunscreen if I'm going out.
Yeah, definitely. Cloud
Okay.
coverage, the UV rays can still go through clouds. So,
And what about the SPF? Like SPF, what is like? Because like I'm not gonna lie, I like Kevin seen it. I'll go SPF 15 with a bronzer. Gotta look good. I'm guessing that's probably not the right thing to do.
so I always recommend SPF 30 or greater.
Oh,
SPF
Uh,
should be the absolute minimum. If you know you're going to be out at the beach or, again, for a long period of time, I usually try to recommend bumping it up to SPF 60 or higher.
oh wow. Okay, that's important to note. So sunscreen is important to prevent skin cancer. Let's move to the topic of skin cancer. What are the risk factors for getting skin cancer?
Right. So there are a lot of risk factors for skin cancer. A few of the main ones. So fair skin. So having blonde or red hair with light colored eyes, you are at a much higher risk to develop skin cancer than someone with dark skin, dark eyes, a history of blistering sunburns as a child. So
Mm.
even a history of one blistering sunburn puts you at an increased risk of developing skin cancer. And kind of just excessive sun exposure. So someone who works out in the sun or spends a lot of time in the sun, that itself is a risk for skin cancer. A few other ones, having a lot of moles. So an increased
mm.
number of moles or
Mm.
abnormal moles on the skin puts you at an increased risk, as does a family history of skin cancer.
And then like when should men be getting screened and how often are we getting screened for skin cancer? Like annually, every 2 years? What's the deal?
Yeah, so the American Cancer Society recommends annual skin exams, every skin exams every 3 years from the ages of 20 to 40, and annual exams above the age of 40.
Well, so
Okay.
every 3 years you should be getting your skin checked out above the age of 20. That's the recommendation.
Yeah, yeah. I
Wow.
mean, and that's just from the American Cancer Society. Yeah.
That's important to know because I think most guys are
I've never
going
had
for
my skin
acne.
checked.
Dude, I've had it checked because, I've had it checked at like by residents, by dermatology residents. But yes, I've had it checked. But no, that's important to know, right? Because the only times I've thought to go to a dermatologist is for acne when I had like
Yeah.
acne and stuff like that. So that's a really good point.
Yeah.
So 20-year-olds can get skin cancer,
Oh
22 year
yeah.
olds, 20.
Yeah. You see melanomas in kids. Yeah, it's rare, but it does happen.
So for our listeners out there, go get your skin checked because that's the recommendation by a dermatologist. So
Yeah. All right. So that's pretty important. That's good to know. So now I have a question. This is like a personal question that I've struggled with for pretty much most of my life. If you've ever seen pictures of me, most of the time I have scruff. I'm never really clean shaven because I break out. When I use a blade to go clean shaven, I break out. I've gone to many dermatologists over the years and I've kind of just used a buzzer to just buzz really close so I don't get like those ingrown hairs and the redness. What is like the proper way to shave? Is there a better way? Does aftershave matter? Like how's the best way to shave to reduce irritation that I've dealt with pretty much my whole life?
Mhm. Yeah, I mean, there are a few strategies to kind of prevent irritation and razor bumps. So first off, you should never do a dry shave. So you should always use, soap or, some sort of shaving cream. The blade should always be a clean, fresh blade. If you are reusing blades, you should replace them often, maybe after every 4 to 7 shaves, because dull blades can sometimes be filled with bacteria, and this will pull on the skin and the hairs a little more, which can also irritate the skin a little bit. Other things you can do, so before shaving, you can gently exfoliate. You can clean with a warm cloth, kind of rub the cloth in circles to try to loosen up some of the hairs that may get caught in the skin. You can consider shaving after your shower to ensure that both your skin and the hairs, are soft and well hydrated. And
does the direction, like going like this versus this, I'm sorry, the YouTube, you can see on YouTube, which way is the right way to shave? Like going from your chin to your neck or your neck up?
So it's all about the way the hair is growing. So you should always shave in the direction your hair is growing, essentially.
Okay. So you're going with the hair.
With the hair, yeah.
See, we asked Dr. Wu about, how to shave on our face. Well, we know personally how to shave the scrotum very, very well.
Correct. Yes. Also, I'm 33 years old, and I think I've been shaving incorrectly my whole life. So.
All right. So, those were good pointers. I hate blackheads. I hate greasy skin.
Yes. Awful.
Girls hate this on guys, probably, So, look, I think one of the things our listeners want to know, and I personally, Justin, wants to know, just like, what are the simple skincare routines? Like, what should we be doing? I know we touched on it earlier, but like, seriously, like when I wake up in the morning, what should I be doing till like end of night? I just want to know what the recommendations are.
No blackheads. Like I have so many friends who look at their nose, the blackheads are disgusting, and everyone comments it's terrible.
Right. So, I mean, one of the most important things you can do to avoid blackheads is to make sure any product that you put on your face is non-comedogenic. Basically, it means that it won't clog your pores. So sunscreens, moisturizers, if you use makeup or anything like that, that should always be non-comedogenic. And to actually treat the blackheads, alpha hydroxy, beta hydroxy acid cleansers, are very good. So usually they're called AHA or BHA cleansers. So these are.
And I can pick that up anywhere. I can pick that up at CVS or Walgreens. Like, what's the name?
Over
like,
the counter.
what do they look like? What's the brand? Because I got to go get some.
Sometimes you can look for the ingredient. So salicylic acid, glycolic acid, lactic acid. Those are, some popular ingredients in the names. And, sometimes the cleanser will say AHA, BHA cleanser on it. So.
And you do that in the morning, you do that at night. How often are you doing it? Like, what's the routine?
So you want to be careful not to over exfoliate, because over exfoliation can actually make the situation worse and also cause skin irritation. So I usually recommend anywhere from 1 to 3 times a week, maximum of exfoliating.
All right.
Yeah. And to kind of go on stay on the exfoliators, I never recommend mechanical exfoliators. So we're talking to those scrubs with those grainy particles, or, kind of a very abrasive washcloth, because that can actually, again, make the situation worse.
What about like the black masks with the coal or whatever, the coal
like the
masks?
Charcoal masks or something.
The charcoal masks. Yeah. Are those good?
So those are good, but it doesn't address the underlying problem. It's more of just kind of the instant gratification of, getting all that stuff out. But at the end of the day, you're not reducing, inflammation or
Hmm.
anything like that, with those masks.
All right, cool. So, we talked about the face, but there's also a lot of like non-face skin issues. And one, Kevin's played sports, I've played sports. We always heard about athlete's foot. I think I've had it before. And you see all these commercials. You used to see Tough Actin, Tenactin with John Madden. I know that
Yep.
ages all of us, but I don't really know too much about it. What is athlete's foot? How do you get it? How do you treat it? How do you prevent it?
So, the athlete's foot, the medical term for athlete's foot is essentially tinea pedis, basically a fungal skin infection of the feet. So this can happen for a variety of reasons. Fungus in general thrives in warm, moist environments. So if you're someone that, you know, wears socks a lot and, tight shoes and exercises or sweats a lot, it's kind of puts you at a higher risk of, having this condition. Usually you get it with through contact in any sort of contaminated surface. So, floor, the towel, other clothing.
That's why the locker rooms and all that stuff. That's where they would. That's where I definitely got it. Playing football in high school and stuff like that. So that sounds like the perfect environment for that
Yeah.
thing to be going. And then how do you treat it?
Right. So a lot of topical medications. So there are over-the-counter medicines. If those don't work, there are prescription topical creams. And if that doesn't work, there's always oral antifungal medications that can be prescribed and taken.
That sounds a little less fun.
All right. Well, let's talk about another skin thing. What about jock itch? What is it? How do you get it? And how do you treat it?
Right. So jock itch, say, similar to athlete's foot, the medical term is tinea cruris, which is essentially a fungal skin infection of the skin in the groin. You can get it through similar means. There's, some theories that if you have it on your feet, you can get it on your groin by, being on your clothes. So,
Justin, yeah, no.
I listen, no comment.
But so does
And
Gold Bond work?
are,
Don't they always advertise Gold Bond?
Yeah, does Gold Bond actually work? That's
Yeah.
a great point.
Basketball, we throw Gold Bond down, all the
Yeah,
time.
Yeah.
throw it on.
Is that the
Throw it on.
powder?
Baby powder.
Yeah,
Baby
yeah.
powder, Gold Bond. Icy, not icy hot. Just kidding. Don't do that.
I mean, it's good. I think it's good for prevention because again, you're trying to change the environment, from a wet, moist, and hot environment to a dry environment. So in that case, it does work. There are some over-the-counter powders that actually have antifungals in them, which probably can help treat. So yeah, I mean, it has antifungal and it can definitely help treat it.
But for both of these issues, we should probably see a dermatologist at some point, I'm guessing.
Right. I mean, if your
currently.
over-the-counter antifungal doesn't work, then yeah, you may need something stronger, or yeah, you may need to take a pill for it.
Awesome. All right, man. Well, listen, I got one final question. Is there any other glaring thing that you feel guys don't do or need to do? I mean, we talked a lot about the shampoo stuff. That blew my mind. I had no idea the soaps. Is there any other final comment that you have with regards to things that dudes need to do or should be aware of? It's okay if
Yeah.
not.
I mean, don't underestimate the power of sunscreen. I think, it can help with a lot of things that, guys may or may not worry about later, such as pigmentation, wrinkles, their skin texture, all the things that, we do see, after, with aging and increased sun exposure.
Oh, on that note,
Yes.
with
Yeah.
aging and wrinkles, something, I think guys start worrying about, wrinkles on their forehead and such. Talk to me about prophylactic Botox. I've heard it from my friends, and they talk about it. They're saying you got to do it prophylactically to prevent
Right.
wrinkles. Is that a
We know
thing?
girls do it. Yeah, we know girls are doing
Yeah.
it, which is cool, but should guys be doing it too?
Yeah.
Yeah, I mean, it's called Brotox for a reason. You gotta do it.
I've heard of Scrotox. I haven't heard of Brotox, but now I'm aware.
Yeah, I mean, if you have concerns about, fine lines in the forehead, around the eyes, your frown line, it's definitely something that, you guys should consider, because it's all preventative. So there's no specific age, where you should be starting it. It's really, the idea behind Botox is that you are paralyzing the muscles, so you can't make those frowns, or you can't raise your eyebrows to create those forehead lines, or create those lines around the eyes. So if you prevent that action from occurring, those wrinkles, won't form.
One final question about Botox. I know it's used for sweat, and I think that that's one reason why guys are probably more familiar with Botox. They have sweaty pits. They have like, whatever, sweat. They sweat a lot. How does that work? Is that a thing you have to come back for? Do people still commonly use it for excessive sweating? Someone told me that if you put it in your armpits, then you get sweat the sweat distributes at other places. How does that work? Is that true?
Yeah, so you can inject Botox into the armpits. You can do it into the hands, the feet, although it's a little more painful in those areas. And it does work. The idea is kind of similar. You're kind of preventing those sweat glands from being able to release sweat in those areas. But you're right. There is something called compensatory hyperhidrosis, where the body sweats for a reason. So if you stop the sweat from one area, inevitably it's going to find somewhere else.
Oh,
So
that sounds
it
dangerous.
is it doesn't happen with everyone, but it is a potential side effect.
All right, man.
Botox.
I learned a lot.
Yeah.
Botox, maybe. Kevin, before you leave, Dr. Wu is gonna
Got to
hook you
get
up
some
with
up
some
here,
Botox.
Yeah, absolutely.
Absolutely. But I want to thank Dr. Wu. I really learned a lot.
Thank you.
I think I'm good looking now, but I'm going to be pretty. Kevin's going to be pretty. We're going to be looking sharp. Like our skin's going to be glisten after this. And I hope all of our listeners learned a lot too, because I think a lot of the things you talked about are things that, we've obviously been doing wrong, because either we haven't been talking about it when we should be talking about it, and we haven't been asking our dermatologists. And I think guys don't go to a dermatologist enough. So I thank you, Dr. Wu. I think that, I want to go to a local dermatologist now and talk about how I can improve my skin and not get jockish, and maybe get some Botox.
Oh, so jockish, huh? No, I'm just kidding.
I said preventative. But thanks again. Thanks again to all of our listeners too. Any questions, comments, concerns, feel free to reach out to us on our social media platforms. We're on Instagram, we're on Twitter, we're on TikTok. You can also find us on YouTube. Please follow us, subscribe. The podcast itself is on all podcasting platforms. Download, subscribe, give us a review. 5 stars is always appreciated. And like we said, these are all on YouTube now, so you can also listen to them and watch them too, which is also always fun, especially when we're talking to a dermatologist. So thanks again, Dr. Wu, and thanks again to all of our listeners. Until next time, have a good one.
Thanks for having me. Take care.